Welcome back. Today, we're going to cut through some of the noise on a really critical health topic, one that affects millions, diabetes mellitus.
It really does.
We've gone through a pretty comprehensive overview you shared, just packed with insights and facts.
Mm.
And our mission now is kind of to distill it all, make it as clear and actionable as possible for you listening.
Right.
We want you to walk away feeling genuinely well-informed, maybe with a couple of those real aha moments.
Absolutely. It's certainly a topic that touches so many lives. Chronic metabolic disorder that's just everywhere globally.
Yeah.
So our aim is to, navigate all this information, really highlight what matters most, and help you grasp the core ideas without feeling totally buried in data.
Like a shortcut through the complexity.
Exactly. Your shortcut to understanding this complex health landscape.
Okay, so let's start right at the beginning. We hear the word diabetes constantly, but what's actually going on inside the body? What exactly is diabetes when someone gets that diagnosis?
Well, at its very core, diabetes mellitus just means your blood glucose, that's your blood sugar, is consistently too high.
Okay, too high.
Yeah. And this happens basically for one of two main reasons. Either your body isn't making enough insulin. Insulin's the key hormone that lets glucose into your cells for energy.
Right, the key.
Or the other possibility is your body's making insulin, but it's just not using it effectively. The cells aren't responding.
Ah, okay, so it's like having the key, but the lock is jammed or something.
That's a great way to put it.
Okay.
Exactly. The lock's jammed.
That makes sense. And it's not just one single condition, is it? My read from the sources is that there are different types, and telling them apart is actually really important.
Oh, absolutely crucial. Understanding the types is fundamental.
So how would you break down the main categories for us?
Okay, so the vast majority of cases fall into two big buckets, type 1 and type 2.
Right.
Type 1 diabetes, often called T1DM, well, that's an autoimmune condition. Basically, your body's own immune system messes up.
Attacks itself.
Yeah, it mistakenly attacks and wipes out the beta cells in your pancreas.
Yeah.
And those are the specific cells that make insulin.
Gotcha.
So the really crucial point here for type 1 is that there's eventually no insulin production. None.
Wow. Okay.
It usually shows up in childhood or adolescence. And for people with type 1, insulin isn't just, a treatment choice. It's essential for survival. They need it, period.
Right. Non-negotiable.
Exactly. Then you've got type 2 diabetes, T2DM, and this one is far, far more common.
Okay.
Now here, the initial problem isn't usually a lack of insulin. It's that the cells in the body become resistant to it.
So the key still exists, but the lock is getting harder to turn.
Perfect analogy again. Yeah.
Yeah.
The cells don't respond properly to the insulin that is there. So the pancreas, it tries to compensate. It pumps out more and more insulin.
Works overtime.
Totally.
Yeah.
But over time, it often just can't keep up that pace. It gets exhausted,
Right.
leading to what we call a relative insulin deficiency.
Ah.
And what's really striking, looking at our sources on type 2, is how big a role lifestyle factors play. Things like obesity, not moving enough, genetics, age, they all contribute.
Yeah, that connection seems really strong.
It is. And while it used to be seen mostly after age 40, the really concerning thing now is we're seeing it in much younger people, even kids, adolescents.
That's alarming.
It is. It's a major public health challenge, not just a trend. Treatment for type 2 usually starts with lifestyle changes, diet, exercise. Then often oral medications are added. And sometimes down the line, insulin might still be needed if things aren't controlled.
That shift to younger people with type 2, that really is eye-opening. Are there other kinds of diabetes we should maybe briefly touch on, even if they're less common?
Yeah, definitely worth mentioning a couple. Gestational diabetes is one that happens only during pregnancy.
Right.
But what's really significant there is that it puts the mother at a much higher risk of developing type 2 later in life. That's a key takeaway.
Okay, good to know.
And then you have rarer forms like monogenic diabetes, things like MODY or neonatal diabetes. These are caused by specific single gene mutations.
Very specific causes then.
Right. And finally, there's also secondary diabetes. This can pop up as a side effect of other health problems like diseases affecting the pancreas, or even some medications can trigger it.
Okay. So given these really big differences, especially between type 1 and type 2, how they develop, let's zoom in a bit on that cellular level you mentioned. How do these different ways they start actually fundamentally affect the body? It feels like that's where the core problem lies.
Yeah, it's fascinating how different the mechanics are. With type 1, remember, the immune system destroyed those insulin-making beta cells, so no insulin.
Yeah.
Zero.
Right.
Now, think of glucose as fuel for your cells, and insulin is the key that unlocks the cell door to let the fuel in.
Okay.
Without that key, the glucose just piles up outside the cells in the bloodstream. It's your high blood sugar hyperglycemia.
So the cells are starving even though there's fuel right outside?
Precisely. They're starved for energy, even with plenty of glucose floating around.
Wow. And type 2, how does that differ at the cell level?
So for type 2, it's a different problem initially. The cells become resistant. Those locks on their doors, they don't respond well to the insulin key.
Okay, that jammed lock again.
Exactly. So the pancreas goes into overdrive, remember, trying to pump out tons more insulin to kind of force those doors open.
Right, working harder and harder.
Think of it like, I don't know, revving an engine constantly in the red zone. You push it to its limit for too long.
Something's going to give.
Right. Over time, this constant overwork can lead to what's called beta cell exhaustion. The pancreas basically gets worn out and eventually can't produce enough insulin anymore to overcome that resistance, and boom, your blood sugar goes up and stays up.
It's amazing how the body tries to compensate, but there's a limit. Okay, so with all this happening inside, what does it actually feel like for someone? What are those first signs, those signals someone might notice that could point towards diabetes?
Yeah, the classic symptoms, the ones that often ring the alarm bells, or what doctors sometimes call the 3 Ps.
3 Ps.
Yeah, it's a trio of signs that the body's trying to cope with all that excess sugar. First is polyuria, that's frequent urination.
Urinating a lot.
Exactly. Because your kidneys are working like crazy trying to flush out the extra glucose through urine.
Okay, makes sense.
And that loss of fluid leads directly to the second P, polydipsia. Excessive thirst. You're just constantly thirsty because you're losing so much water.
Right, trying to replace it.
And the third P is polyphagia. That's increased hunger. Even though you're eating, your cells aren't getting the glucose fuel they need.
Because of the insulin problem.
Right. So they send signals saying, hey, we're still hungry, even if you've just eaten.
Wow. Okay, polyuria, polydipsia, polyphagia. Got it. Are there others?
Oh, yeah. Beyond those, you might see unexplained weight loss. That's actually more common in type 1 as the body starts breaking down fat and muscle for energy since it can't use glucose. Fatigue is a really big one. Just feeling wiped out. Blurred vision can happen too, as high sugar levels can affect the lenses in your eyes. Wounds might heal really slowly. And sometimes numbness or tingling, often in the hands or feet, that can be an early sign of nerve damage, what we call neuropathy.
Those sound like pretty clear red flags. So if someone's noticing these kinds of symptoms, how do doctors actually figure out if it is diabetes? What are the tests involved?
Right, the diagnosis isn't just based on symptoms. It relies on specific blood tests that measure glucose levels. There are clear thresholds.
Okay.
So one common one is a fasting blood glucose test. You fast overnight, then get your blood drawn. If that level is 126 milligrams per deciliter, that's mgdl, or higher on 2 separate tests.
126 fasting twice.
Right, that's generally diagnostic.
Yeah.
Another way is a random glucose test taken anytime. If that's 200 milligdl or higher, and the person clearly have those symptoms we just talked about.
Like the 3 Ps.
Exactly. Then that also points strongly to diabetes.
Okay. 200 with symptoms.
Then there's a really useful test called the HbA1c, or hemoglobin A1c.
A1C. Yeah, I've heard of that one.
It's great because it gives you an average picture of your blood sugar control over the previous 2 to 3 months. It's not just a snapshot in time.
Ah, like a longer-term view.
Exactly. An HbA1c level of 6.5% or higher is generally considered diagnostic for diabetes.
6.5%. Okay. Any others?
One more main one is the oral glucose tolerance test, the OGTT. For this one, you drink a specific sugary drink.
Fun.
Huh? Maybe not. And then they check your blood glucose levels 2 hours later. If it's 200 milligdl or higher at that 2-hour mark, that also confirms diabetes.
Okay, so several ways to get a clear diagnosis. Once it is confirmed, what's the game plan? What's the typical treatment path look like? Is it just about taking medicine?
No, definitely not just medicine. It's really a comprehensive strategy.
Yeah.
And honestly, for all types, but especially for type 2, lifestyle changes are absolutely fundamental, foundational.
Diet and exercise.
Yes, exactly. Focusing on a healthy diet usually means lower in refined sugars, processed carbs, higher in fiber, fruits, vegetables, lean protein. Regular physical activity is huge. And managing weight, if needed. These aren't just sort of nice-to-haves. They are incredibly powerful tools in managing blood sugar.
So lifestyle first, or at least alongside everything else.
Always. Then, for medications, well, for type 1 diabetes, since the body makes no insulin, insulin therapy is the only treatment. That's it.
Right. As you said, essential for survival.
Correct. For type 2, it's often a staged approach. The first medication usually recommended is metformin.
Metformin, yeah, that one comes up a lot.
It does. It mainly works by helping your liver make less glucose and making your body's cells a bit more sensitive to the insulin you do produce.
Okay.
If metformin and lifestyle aren't enough, then doctors have several other classes of oral medications they can add. Things like sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors,
Hmm.
GLP-1 agonists, which are often injectables but not insulin. They all work in different ways to help lower blood sugar.
There's lots of options then.
Yes. And, importantly, if type 2 diabetes remains uncontrolled despite lifestyle changes and these other meds, then insulin therapy might become necessary for people with type 2 as well.
Okay, so insulin isn't just for type 1, potentially for type 2 later on too.
Okay.
That's a lot of tools in the treatment toolbox. But thinking longer term, what about the potential problems down the road? What are the long-term complications people really need to be aware of if diabetes isn't managed well? This feels like where the why bother with all this management really hits home.
Absolutely critical point.
Yeah.
Because poorly controlled diabetes, over time, can lead to really significant and sometimes life-altering complications. We usually group them into two categories, microvascular and macrovascular.
Micro and macro, small and large.
Exactly. Microvascular means affecting the small blood vessels. This includes retinopathy damage to the blood vessels in the retina of the eye. If it progresses, it can lead to vision loss, even blindness.
Wow.
Then there's nephropathy damage to the kidneys. This can impair kidney function and, in severe cases, lead to kidney failure, requiring dialysis or a transplant.
Serious stuff.
Very. And the third main microvascular one is neuropathy nerve damage. This often starts as numbness or tingling, usually in the feet or hands, but can progress to pain, loss of sensation. And that loss of sensation is particularly dangerous for the feet, leading to ulcers that don't heal well and, in the worst cases, can require amputation.
That's sobering. And the macrovascular, the
Right.
larger vessels.
Right. Macrovascular complications involve the bigger arteries. Diabetes significantly ramps up the risk of major cardiovascular problems. Things like coronary artery disease, narrowing of the arteries supplying the heart, which can lead to heart attacks.
Okay.
Also, a much higher risk of stroke due to effects on blood vessels in the brain. And peripheral artery disease, which is narrowed arteries reducing blood flow to the limbs, mostly the legs.
So heart attacks, strokes, circulation problems.
Yes. The combined impact of all these potential complications, both micro and macro, really underscores why keeping blood sugar levels under control as much as possible is just so incredibly important.
It absolutely paints a clear picture of why monitoring is so essential. So how is diabetes typically monitored over time to try and prevent these things, or at least catch them early?
Yeah. Ongoing monitoring is it's crucial. A big part of it is often self-monitoring of blood glucose, or SMBG.
Checking your own sugar levels.
Exactly. Using a glucose meter to check levels at home regularly. This helps people understand how food, activity, stress, medication affect their blood sugar in real time, day to day.
Gives them direct feedback.
Precisely. Then there's that HbA1c test we talked about for diagnosis. That's also used for monitoring, typically done every 3 to 6 months, to see that longer-term average control.
Right, the bigger picture view. And beyond blood sugar itself, regular checkups are key to screen for those complications we just discussed. Annual comprehensive eye exams to look for retinopathy. Regular thorough foot exams to check for neuropathy, ulcers, circulation issues, and periodic kidney function tests using blood and urine samples to screen for nephropathy.
So it's a whole package of monitoring: blood sugar, eyes, feet, kidneys.
It really is. It's a holistic approach, managing not just the number, but watching out for the potential consequences across the body.
Wow. We've really covered a huge amount of ground today on diabetes mellitus. We sort of peeled back the layers on what it is, explored those really distinct types, type 1, type 2. The others dug into the actual mechanisms, how they differ at that fundamental level.
Right, the autoimmunity versus resistance.
Exactly. And then walk through the symptoms people might experience, how doctors diagnose it, the whole range of treatment approaches from lifestyle to complex meds, and crucially, those serious long-term implications in how monitoring works.
Whether it's for your own health or someone you know, or just to be better informed, I feel like understanding these details from the sources you pull together is just incredibly valuable.
I agree. We've definitely mapped out the broad landscape of diabetes. But, this condition is so vast, and there are these immediate acute concerns that are equally vital, things that can happen suddenly.
Yeah, like emergencies.
Exactly. Things like DKA, diabetic ketoacidosis, or severe hypoglycemia, dangerously low blood sugar. So thinking about all we've discussed, What aspect of this complex condition, perhaps those critical immediate concerns, do you think is most important for us to potentially explore further in another deep dive?